So with cupping therapy, the first thing you need to make sure you have is alcohol. So where I have this cotton wool and I'm dipping it in this liquid solution, that is 91% of pure alcohol. So it is highly inflammable. So please be careful when using this. Yep. So what I've got in my hand is a tweezers and a cotton bud. Okay, alcohol, and just use a lighter. Now what you want to do, these are glass cups. So as you put the heated cotton wool into the glass cup, it creates a suction on the skin. And what you want to do is, it depends on where your patient's area of pain is or where they might be having issues, that's kind of where you want to target. Now cupping therapy is awesome. The best way to think of it is simply it helps with reducing tension and pain. So if you've had a repeated injury or you've got tension somewhere, what tends to happen is you get stagnated blood. What stagnated blood is basically when the blood kind of just sits there. Now when blood tends to just sit there and it's not getting fresh blood flowing through the area, what can happen is it increases the protein, and they describe this blood as toxic. So what the cups will do here is it'll create a suction to allow fresh blood to flow to the area, to bring nutrients to that area to promote healing. And with that, it helps with inflammation and it helps with pain. Now to get the cups off is pretty simple. Sometimes they can be a little bit tricky, a little bit difficult. So all you want to do is just gently hold the skin and you just want to pull them off. Now please note, with cupping therapy is awesome because it does show areas where you might have more problematic areas or issues. So where the darker spots are, darker circles, that's usually a sign of where you might have had a bit more stagnated blood in that area. So with this client, you can kind of see at this angle, top left of his shoulder and his lower back are the areas. I'm going to kind of zoom in on the next clip and you'll have a better look at the areas of where there's more tension. So as you can see here, yep, that darker circles on the outside of his scapula, just kind of round where the infraspinatus would be.